how to read your prescription label and inject your medication. For this portion of the video, we will be going over how to read your prescription label. Highlighted in red is the information of what medication you have received and the concentration of the vial. Highlighted in blue is the amount of medication in milliliters that is contained in your vial. This should match the number of milliliters listed on the side of the vial. If there are any differences, please notify your pharmacy or provider immediately to rectify the situation. Next in purple, we have listed the number of refills left on your prescription. This value is measured in milliliters, so if you have a prescription for a 4 milliliter vial with 2 refills on it, this area will list an 8. However, your doctor or provider may be sending your orders periodically, so if you are concerned there are no refills listed, please contact your provider as they manage how your prescriptions are sent to us. In green, we have listed the drug's directions. This area is the dosing instructions and any specific details about the medication you are receiving. For your dosing, please draw up your syringe to the units marked in this area. Next, we will show you how to inject your medication. Here we have your guide to how to inject your medication that is included in every bag of your compounded medication. This information sheet simply states the instructions we are about to cover. In the image in the bottom left corner, we have highlighted the places you can inject your medication. However, we do recommend injecting in the area 1 to 2 inches around your belly button and rotating spots for optimal use. Now let's draw up your medication. In front of you, you should have your medication, your syringe, and your alcohol prep pad. The first thing you want to do after taking the cap off your vial is wipe off the top of the vial with an alcohol swab. After wiping the top, place the alcohol swab near you to use for cleaning the site of injection. After which, look at your label and look at how many units you will be drawing into your syringe. Here we will be using 12.5 units as stated on the example label and highlighted in red at the bottom. First, you want to remove the caps off your syringe. Be careful not to touch the needle. Then inject the needle into your vial and draw up the specified number of units that your prescription label has written on it. Here we have an example of what the 12.5 units filled would look like on a 100-unit syringe. To inject. First, use that alcohol pad from earlier to wipe off the area of injection that you have determined. Next, you want to use one hand to pinch the area of injection and the syringe filled with the medication in your other hand. While pinching the area, inject the needle into the area and push down the plunger on the back of the syringe all the way down and remove the syringe. You have now completed your injection. Thank you for watching our guide on how to read your prescription label and how to inject your medication. If you have any further questions, please contact us at compounding@redrockrx.com or compounding@redrockrx.com if you live in Nevada or California. And we wish you the best on your weight loss experience.